Good day, everyone. We are the Group B2, and today we're going to be presenting our topic, glaucoma.
Hi, my name is Arbela Montero from BSN1K.
I am Alexa Leonor from BS1K.
Hi, my name is Ina Torres Lucis from BSN1 King.
My name is Precious Hermione P. Hamsin from BSN1K.
My name is Jasmine H. Lastre from BSN1 King. Glaucoma is a complex eye condition characterized by elevated intraocular pressure or IOP that may progress to vision loss over time. It has been called the silent thief of sight because the loss of vision usually occurs slowly over a long period of time. This eye condition is categorized into primary or secondary types and further into open angle or closed angle variants.
Structure and function. Optic nerve head, ONH, also known as the optic disc, is a crucial structure located in the posterior ocular fundus. It serves as a critical junction facilitating the exit of retinal ganglion cell axons and the entry and exit of retinal blood vessels. This intricate structure plays a vital role in transmitting visual information from the retina to the brain. However, the ONH is also a vulnerable area susceptible to damage from elevated pressure inside the eye, known as intraocular pressure, IOP. High IOP can compress the ONH, leading to damage of the nerve fibers and lamella cribrosa, which can result in a loss of nerve fibers and subsequent vision loss. Trabecular meshwork. A spongy tissue situated near the cornea plays a crucial role in maintaining healthy intraocular pressure, IOP, by regulating the outflow of aqueous humor from the eye. This intricate network of tissue lies within the drainage angle, facilitating the flow of aqueous humor from the anterior chamber into Schlemm canal, SC, and ultimately into the venous system. Approximately 80-90% of aqueous humor drainage ocular through this pathway, highlighting its vital role in maintaining eye health. Dysfunction of the trabecular meshwork, however, can lead to an increase in IOP, a primary risk factor for glaucoma, a blinding optic neuropathy. Retinal nerve fiber layer, RNFL, is indicate layer of nerve fibers at the innermost layer of the retina. Composed of axons of retinal ganglion cell, RGC, the RNFL serve as a crucial pathway for transmitting visual information from the retina to the ONH. Glaucoma cause damage to RGC, their axons, and associated glial cells, leading to structural changes in the top optic disc and RNFL, resulting in progressive and irreversible vision loss. This loss disrupts the flow of visual information from the eye to the brain, leading to visual field defects and ultimately blindness if left untreated.
Here is the causes and risk factors of glaucoma. It is a condition that can damage the optic nerve, often develops without any cause, but many factors can affect it. However, increased intraocular pressure is a key factor. Aqueous humor, the fluid that nourishes the eye, normally flows through the pupil and drains through canals near the iris and cornea. It may happen when your pupil damages and becomes too big, dilated too quickly. In glaucoma, these drainage canals become blocked, leading to a buildup of fluid and increased pressure within the eye. This pressure damages the optic nerve, potentially causing vision loss. This also can be inherited, meaning it's passed from parents to children. Next is the risk factors. First factor is the age. The risk increases with age, especially for individuals over 60 years old. Ethnicity. Black and Hispanic individuals are at higher risk and often develop the disease earlier. Asian and Inuit populations are more susceptible to angle closure glaucoma. Family history. Having a first-degree relative, parents or siblings with glaucoma increases your risk. Genetic mutations. Scientists have identified certain gene mutations that can lead to glaucoma. Vision issues. Being nearsighted or myopic or farsighted hyperopic can also increase risk. Blood pressure. Both high blood pressure or hypertension and very low blood pressure or hypotension can contribute to risk. Fluctuation may cause damage to the optic nerve. Corticosteroid use. Long-term use of corticosteroid has been linked to increased risk. Corneal thickness. A thin central cornea may elevate risk. Eye injuries or surgery. Previous blunt injuries or surgeries that lead to bleeding can block the eye's drainage system. Lastly, we have the importance of eye exams. Early detection is crucial in preventing vision loss from glaucoma. It is recommended to get a comprehensive dilated eye exam at least once every 2 years, especially if you have any of the above risk factors.
Types of glaucoma. Open angle glaucoma. also known as primary open-angle glaucoma, is the most common type where the drainage canals become clogged, causing gradual pressure buildup and damage to the optic nerve. It is a lifelong condition named for the open angle between the cornea and the iris. This leads to peripheral vision loss and, if untreated, central vision loss. Closed-angle glaucoma, also known as angle closure or narrow-angle glaucoma, occurs when the lens pushes the iris, narrowing the angle between the iris and cornea. This blockage rapidly increases intraocular pressure, causing eye pain, redness, blurred vision, and other acute symptoms. Normal tension glaucoma occurs when optic nerve damage happens despite normal intraocular pressure. This may be due to low blood flow or a genetic sensitivity to normal pressures. Congenital glaucoma, also known as infantile glaucoma, occurs in infants due to improper development of drainage canals. Treatment often requires surgery and, in some cases, medication. Pigmentary glaucoma begins with a condition known as pigment dispersion syndrome, wherein pigment granules from the iris enter the eye's fluid and clog the drainage canals, increasing intraocular pressure. Exfoliative glaucoma, also known as pseudo-exfoliative glaucoma, is caused by flakes peeling from the lens, which clog the drainage system, leading to increased eye pressure. Secondary glaucoma refers to glaucoma caused by another condition such as injury, inflammation, medications, cataracts, or diabetes. Treatment depends on the underlying cause. Neovascular glaucoma results from new blood vessel formation on the iris, usually linked to conditions like diabetes, which block the eye's drainage channels and raise pressure. Traumatic glaucoma is caused by eye injuries, either from blunt trauma or penetrating wounds, and can result in either acute or delayed increases in intraocular pressure. Uveitic glaucoma arises from inflammation of the uvea, also known as the middle layer of the eye. The inflammation or its treatment, such as steroids, disrupt the eye's fluid balance, leading to increased pressure. Stages of glaucoma. Stage 0. Pre-glaucoma stage. Intraocular pressure may be elevated or within the normal range. Optic nerve changes might be detected by an eye doctor, but no definitive damage has occurred yet. Stage 1. Early glaucoma. In the early stages of glaucoma, the drainage angle starts not working properly and may not let much fluid flow through. As the eye continues to make new aqueous humor, the pressure in the eye starts to rise. The optic nerve begins to show damage and there is a slight loss of peripheral vision that may be detected by visual field tests. Stage 2. Moderate glaucoma. The second stage of glaucoma is when you start noticing symptoms. This may include patchy or blurry vision or mild to moderate eye pain. At this point, your doctor may recommend medication therapies like topical beta blockers or carbonic anhydrase inhibitors. Stage 3. Advanced glaucoma. The third stage of glaucoma is when there is significant optic nerve damage with large areas of peripheral vision loss. Depending upon your level blockage and angle closure, your doctor may recommend interventions like medications or surgery. Stage 4. Severe glaucoma. The fourth stage of glaucoma is when there is a major vision loss including tunnel vision. There is a severe optic nerve damage with central vision potentially beginning to be affected. Stage 5. End-stage glaucoma. This occurs when there is little to no healthy eye tissue left. There is an extensive optic nerve damage with the majority of the visual field loss. Central vision may also be gone.
Glaucoma is an eye condition that may cause vision loss if not addressed promptly. The potential complications include the following: vision loss and blind spots. Glaucoma can cause permanent damage to the optic nerve, leading to gradual loss of peripheral vision, also known as tunnel vision. Over time, this can develop into blind spots, affecting both central and peripheral vision. Optic nerve damage. The increased IOP or intraocular pressure compresses and damages the optic nerve fibers, which disrupts the transmission of visual signals to the brain. This nerve damage is usually irreversible. Hypotony. Hypotony occurs when intraocular pressure drops too low, usually below 6 to 8 mmHg, which can impair the eye's normal function. It often happens after glaucoma surgeries aimed at reducing IOP. Corneal edema. Glaucoma can cause swelling to the cornea, leading to blurred vision, pain, and discomfort. This complication may arise from increased eye pressure or post-surgical outcomes. Hyphema. Hyphema is the presence of blood in the anterior chamber of the eye, often occurring after eye trauma. In the context of glaucoma, hyphema can result from surgical procedures or trauma related to elevated IOP. It can lead to increased pressure within the eye, worsening glaucoma and potentially causing further vision impairment. Cataract formation. Individuals with glaucoma, especially those undergoing prolonged treatment, have an increased risk of developing cataracts. Cataracts cloud the eye's lens, leading to blurred vision and can further complicate vision problems in glaucoma patients.
There are two main types of glaucoma interventions: pharmacologic interventions and non-pharmacologic interventions. Pharmacologic interventions includes eye drops and oral medications. Eye drops, these are the most common initial treatment for glaucoma. They work by reducing intraocular pressure. Examples include prostaglandin analogs, beta blockers, alpha-adrenergic agonists, and carbonic anhydrase inhibitors. Oral medications. In some cases, oral medications such as carbonic anhydrase inhibitors may be used to lower intraocular pressure. Non-pharmacologic interventions include laser therapy, surgery, and regular eye exams. Laser therapy, this procedure uses a laser beam to create tiny holes in the iris or trabecular meshwork, improving the flow of aqueous humor and reducing intraocular pressure. Surgery. In severe cases of glaucoma, surgery may be necessary to improve the drainage of aqueous humor. This can be done through trabeculectomy, a traditional surgical procedure, or with MIGS techniques, minimally invasive glaucoma surgery. Lastly, regular eye exams. Early detection is crucial for managing glaucoma. Regular eye exams, including tonometry to measure intraocular pressure, are essential for monitoring disease's progression and adjusting treatment as needed.